Hi guys, my name is Jenna Moulton and this is my PLC disability presentation draft. The one that I got is nonverbal autistic disorder, so I'm going to teach you guys a little bit about this. So here's a little bit of my schedule. I kind of left some of it out, but I'm first going to define the disability, and I'm going to tell you the causes of it. Then I'm going to explain the symptoms and signs of it, and then I'm going to go over how to manage this disorder. So, what is nonverbal autistic disorder? Nonverbal autistic disorder is also referred to as non-speaking autism. It is where an individual has a crucial difficulty using spoken language to communicate. This means they may not speak at all or can only use very limited verbal communication. Regardless of this, they will still be able to understand language and what you are saying and will be able to express themselves through other methods such as gestures, pictures, or assistive technology. And I added this picture on the right. So, first, I am going to go over the key points of this disorder. First, there is limited speech. So, people with nonverbal autism may not be able to speak words clearly. They may only be able to use a few words, or even they may just have difficulty forming sentences. Next is alternative communication. While not being able to speak verbally, people with nonverbal autism can still be able to communicate through using gestures, pointing, picture communication systems, or even assistive technology like speech generating devices, which is very cool. Next is understanding language. Even if they are not able to verbally speak, they will still be able to understand spoken language and what you are saying to them. Next is social interaction challenges. Nonverbal autism can be very challenging when it comes to social interactions due to difficulties expressing their needs and desires through verbal communication. So, next is the causes of this disorder. So, there is not particularly a single cause. It's likely a combination of factors, so I'm going to go over a few of those now. First is brain development differences. There is potential differences in brain activity and processing in nonverbal autistic individuals, particularly regarding auditory processing and language areas. Next is genetic factors. There is certain genetic variations that have been identified that may increase the likelihood of autism, which could contribute to nonverbal communication difficulties. Next is joint attention challenges. They have difficulty with joint attention, the ability to share focus on an object with another person. This is often observed in autistic children and may impact their language development. Next is motor skill limitations. In some cases of this disorder, physical challenges with mouth movements needed for speech, like childhood aprasia, can also contribute to having nonverbal communication. Okay, next we have things to remember with this disorder. So it is being nonverbal does not necessarily mean someone has an intellectual disability. Next is communication potential. Nonverbal autistic individuals can still communicate effectively through alternative methods, as mentioned before, like gestures, visual aids, and assistive technology. And lastly, early intervention is very crucial. Therapy services are essential for supporting nonverbal autistic individuals. This helps develop some communication skills. Okay, Next, we have some symptoms and signs of this disorder. So, communication difficulties. These include not responding to their name, not initiating conversation, and also not speaking in complete sentences. Next, we have repetitive behaviors. These include rocking back and forth, flapping hands, and making unusual movements. Third is sensitivity to stimuli. So, this includes being sensitive to sounds, smells, tastes, or touch. Fourth is social difficulties. This includes not playing or sharing with others and preferring to be alone. And fifth, we have challenges with nonverbal communication. This includes not understanding or using eye contact, gestures, facial expressions, or body language. And then next, we have speech regression. This includes using sounds instead of words, or only using a few words. Next is rigid preferences. This includes having a strong preference for sameness or like having a routine. Next, we have delayed developmental milestones. This includes not meeting developmental milestones for language or speech. And lastly, we have unusual interests. This includes having narrow interests or exceptional abilities in certain areas. Okay, next slide is how to communicate with someone with nonverbal autism disorder. First is using simple language. Using short phrases and simple language will help your child or student understand and imitate you. Next is visual aids. Using pictures, flashcards, or an AAC device to help your child understand what they want. Next is imitate your child. Mimicking your child or student sounds and behaviors will encourage them to copy you. Next is using gestures and eye contact. So modeling and responding to your child's gestures and eye contact is very helpful when trying to communicate with them. And lastly, we have using assistive technology. So, considering speech generating devices or other technology assisted options is a crucial part of communicating with someone with nonverbal autism disorder. Next slide. So, here are some other managing tips, such as playing, be patient, and providing support. So, encouraging play and social interaction. This is typically how, playing is typically how children learn language. So making play fun and interactive is very helpful for them. Next, using pretend playing. Pretend play is a fun way to teach language skills. And then singing. Singing can encourage social interaction. Next is be patient. So, being patient and understanding is crucial. So don't really expect your child or student to speak right away. Give them lots of opportunities to communicate. Next, follow your child's interest. Follow along with your child or student's interests instead of interrupting them. And last category is providing support. So, provide calming items. This can include a favorite blanket or a stuffed animal to help calm your child or student. And lastly, we have provide support for challenging behaviors. Label their emotions and help your child or student find more functional ways to communicate. So all these three categories can be crucial for helping or managing someone with this disorder. And next, we just have my video links that you can click on and watch the two helpful things that I showed. So that is all. Thank you guys for following along. Bye.